My name is Herman Parker, and I am the Director of Technical Services with Radiology Associates. As Technical Director with Radiology Associates, my job is to basically handle anything related to equipment, from the purchase to the service, maintenance, replacement, disposal, anything associated with imaging equipment, that is my responsibility. We pride ourselves on having the latest and greatest in diagnostic imaging equipment. We constantly evaluate our equipment, not only with other competitors, but with other equipment within our entire enterprise. For the patient, quality is what matters. Image quality is what matters. And we constantly evaluate that image quality and decide when to replace that equipment. We chose Philips Medical Systems as our vendor of choice for PET-CT. We've had a relationship with Philips for over 15 years. The Philips Varios system is the latest and greatest system from Philips. It is the first fully digital PET-CT system. And that's important because when you acquire in a digital format, you get much more information. When you acquire an analog and then convert to digital, you lose data, you lose information. With the Philips Varios PET-CT system, you do have that high resolution, high image quality image that makes it much easier for our radiologists to diagnose images.
There are multiple types of MRI scanners. Can you briefly explain what they are and why using the 3T MRI scanners at our centers is the best?
There are a lot of MRIs available on the market today. You have the open MRI machine, which is great for people that are claustrophobic. However, with an open MRI machine, it's what we call a low field MRI. Here at Radiology Associates, we use high field MRI systems, specifically the 3 Tesla MRI. I always refer to cameras, regular cameras. Remember back in the old days when we had the Polaroid cameras or the fling cameras that you would run down to the drugstore to get them developed? Images looked great, images were fine. But then they came out with digital cameras, the 10 megapixel digital cameras. Those images were so much more clearer, so much more resolution. And that's almost exactly how it is with an open MRI or a low field MRI or a high field 3 Tesla MRI. So that helps the radiologist look at the image and give them a more detailed analysis or diagnosis of the body.
At Radiology Associates, our CT scanners have unique capabilities that other scanners do not have. Can you describe some of those unique capabilities and why they are important?
So at Radiology Associates, we have 64 slice scanners throughout our entire Daytona division. We have a brand new CT scanner that we've just installed at one of our facilities called the GE Maxima. And this is unique and different from any other system on the market right now because it uses AI or artificial intelligence. There's a camera called an extreme camera that takes a 3D look of the patient's body before they have their scan done. And it can look, using some highly technical depth analysis, tell how much dose that patient needs while scanning. So we offer the lowest dose, lowest noise scan with the highest image quality, again, for our radiologists to give a more detailed diagnosis.